A recommendation for Dr. Beverly is one of the easiest things I could do simply because of my experience. The way she works with you, alongside of you, helping you along the way, and is very encouraging. She was always there for me and giving me the latitude to work around some of life's challenges, and we still were able to progress. I'm Colonel T.L.N. Nevels. I am proud to have served my nation for 31 years in the Air Force. I've had the opportunity to travel around the world, and now I live in the heart of America. That's near Kansas City, Missouri. Before I started working with Dr. Beverly, things were rather chaotic. When you're in the military, you don't have time to think about the normal aches and pains. And so once I retired, all of that came back to haunt me. Those years of moving past it and keeping going, always mission-oriented. And I was fortunate enough to see Dr. Beverly on a panel discussion, and she was talking specifically about a very important concern that I was experiencing, that is diabetes. And so I reached out and engaged with her, was impressed with her presentation during the panel, and even more impressed once I started talking with her. I needed help, and she had the ability to do that, and I'm so grateful for that opportunity. Dr. Beverly's bedside manner was wonderful, easy to talk with, and I particularly admired the fact that she had a problem and found a way to fix it and was willing to share that with others. Right away, the initial assessment pointed out a couple of items that I needed to pay attention to, and she helped me with that, and that got me started. Things in the past that I've tried, I noticed that I was taking more and more prescriptions, and it seemed to be that the ritual of getting up and pouring out a handful of pills, that was not appealing, and I felt like I had to do something about that. And that was one of our initial conversations. I'll share with Dr. Beverly, I was very concerned that I seemed to be taking more and more prescriptions, and the situation did not seem to be improving. Perhaps the thing that was most surprising with Dr. Beverly was it wasn't just a one-size-fits-all. She listened very closely to my feelings, my experiences before making any kind of assessment, and that was very appealing. The first thing she did was give me some basic tests that I had not been given before, and they identified some things that I needed to pay attention to right away. The thing that I'm doing now that's different is I'm paying much more attention to what I put in my body. But I'm enjoying it because I know that if you want to have a better life, then you've got to be careful about how you fuel your body. I consider myself very, very fortunate to have had the opportunity to meet Dr. Beverly, to work with her, and which I continue to do, because she's one of those folks that comes along that you know this is someone who is genuine, who is caring, and is extremely competent in what she does. And she sees you not as a number, but really as a person.